आमचे बरोबर जॉईन जातात गोंयाचे नामनेचे पल्मोनॉलॉजिस्ट आदले IMA स्टेट प्रेसिडेंट डॉक्टर अनिल महेंद्रिता. डॉक्टर, वेलकम टू द शो. डॉक्टर, टेल अस की राइट नाउ व्हेन यू सी दिस सिच्युएशन, what are your observations? The number of cases, number of mortality, number of positivity rate. As an expert, what do you feel? Why this is happening and why the mortality rate is so high right now?
Good evening, sir.
Yeah.
Let me tell you that the mortality rate, like is already been discussed, is basically late reporting of the people. People are coming late to the hospital. People are coming in very, very serious condition. That's one thing. Late reporting. Second thing is that this virus is very, very virulent now as compared to the first wave, where it was progressing very slowly. And this virus is spreading much, much faster. The contagious rate of this virus is very, very high. Here we need to request the people when they become symptomatic. Government has started the prophylaxis with ivermectin and doxycycline. Anyone who comes with temperature, irrespective of whether results are ready or not ready, please start yourself doxycycline and ivermectin and monitor your oxygen saturation at home. It's very important that these patients at home monitor the oxygen saturation at baseline, and they have to do the saturation again at the end of 6 minutes. If the saturation at the baseline is 93% and above, and at the end of 6 minutes is again the same, it should not drop less than 93%. Then it's okay. The person has to do it twice a day. But if it drops, the person has to immediately report to a doctor, get himself examined, get the viral markers done, get a CT scan done, and start on steroids. The crucial time is between 5 to 8 days. Up to 5 days, the patient usually has to take multivitamins, doxycycline, ivermectin, and plenty of fluids. You need to hydrate yourself very well. The crucial time is between the 5 to 8 days to 9 days when the saturation drops, when the virus multiplies. So this is the time when the patient has to be very careful. If any of these features are there, need to report to the doctor and start on steroids and blood thinner. These are the only two drugs which have been proved to be effective in COVID. Now, the commonest misconception which people are going around is they get fever today, they get themselves tested. If they get a report on the same day, they get a CT scan done, they get a viral markers done. Some doctor puts them on steroid, which is actually wrong.
Okay.
Someone is tested today, and if he's got fever only, but no breathlessness and nothing, I will request that person, please do not subject yourself to CT scan or blood test, or please do not start steroids. 1 to 5 days, the virus is replicating, the virus is multiplying. This is a time when the steroids are not to be started. Steroids have to be started after 5 days, 6 to 8 days. So this is one thing which is very, very important to keep in mind. A lot of teleconsultations are going on. I'm seeing a lot of prescriptions where patients are starting themselves on steroids. And these patients come later on with worsening of symptoms. So do not put yourself on steroids. Do not start steroids on your own. Please start steroids only on the opinion of the expert.
Doctor, tell me one thing. You said that from day 5 to day 9 is very critical.
That's right.
Tell us more about it.
This is the time when the symptoms increase. This is the time the virus replication will reach the peak. This is the time when the lungs get infected. This is the time when the saturation level falls. This is the time when people have to keep an eye on the saturation. They have to observe that the oxygen saturation doesn't drop. If the oxygen saturation drops, they need to rush to the hospital. A small dose of steroids during this stage will definitely help a patient.
Doctor, tell me one thing. Now, every doctor says that this is about lungs. And if you are feeling good in your lungs, you are comparatively okay. When this issue, and as an expert, when you talk about COVID and lungs right now and seeing our mortality rate, the kind of CT scores our people are getting, how do you explain it in a layman's language when it comes to COVID and lungs? If a person is positive, what are the signs where he should feel alarming?
Alarming sign is uncontrolled fever after 5 days, breathing problem, breathlessness at rest, saturation at rest less than 93%, or if the saturation is more than 93% and after 6-minute walk it drops below that, is very important. He needs to report to the doctor, get himself examined, get a CT scan done. Any CT scan score with about 12 needs to be treated on an aggressive basis. Up to 9 and 12, 10, 12, we have been able to manage at home. But anything about 12 and patients with comorbidities, patients with kidney disease, diabetes, hypertension, elderly with heart problem needs to be extra careful. So
Doctor,
these patients has to be
now
monitored rigorously at home.
this CT score, CT scan, suddenly they have become a huge discussion points in our life. So when you are advising your patients, who should do a CT scan and who should not or need not do a CT scan?
So CT scan, again, I said, should be done after 5 days, not the first 5 days of the infection period. It has to be done if the patient's saturation drops, if the patient has got profuse cough, continuous cough, खोकली येता दिसभर खोकत राहता, खरस मारता तिका, saturation drops जाता, then we need to subject these people for CT scan. Unnecessary, please, we are not supposed to do CT scan, especially in the first 5 days. That's become the common trend. This is a misuse of the CT machine here right now.
Yeah,
Anyone
that's
positive,
why I'm asking.
people, yeah. Anyone positive is directly going on his own and getting the CT scan done, which is wrong. So please
तुम्ही
consult.
म्हणतात की सिटी स्कॅन सगळ्यांनीच करपाची गरज ना.
ना, ऍब्सोल्युटली नो. कोणा खरंच मारता, कोणा खोकली येता भरपूर, 5-6 दीस मागीर कंट्रोल जायना, सॅच्युरेशन ड्रॉप जाता, तेका आमी सीटी स्कॅन करपा जाय.
सगळ्यांनीच वचून आपूण पॉझिटिव्ह आसा म्हणून सिटी स्कॅन केलें इज अ युजलेस एक्सरसाइज.
ऍब्सोल्युटली युजलेस एक्सरसाइज. स्पेशली पयले 5 दीस करपाचे ना तो.
दोतोर एक गजाल आय रियली वॉन्ट टू आस्क यू की लंग्स जेन्ना आमी म्हणटात, यू सेड दॅट टील मे बी 12 सिटी स्कोर you can be treated at home, but what happens after that? Means everybody now, many people are coming out of COVID, many people had very high CT score, somehow they came out of it, some had very low CT score, mild to moderate, they are also coming out of it. What about post COVID? Any precautions that people need to take? What happens to our lungs post COVID?
Post COVID is very important. Many of these patients has to be counseled. Very important counseling of these patients, especially patients with severe lung disease. They had to be told that their lungs are not recovered fully. They are prone for secondary infection of the lung.
Okay.
They need to be told to do steam inhalation, physiotherapy of the lung, and also to be started on some antifibrotic agents. We need to actually post-COVID is a syndrome which comes after 6 to 12 weeks.
Okay.
It's not the immediate 1.5 months. The complication, the fibrosis takes 1.5 months to set in minimum. So that's the time when we need to put this patient on antifibrotic. There's some studies come out. You start the antifibrotic, especially with the patients with severe lung disease, immediately. Maybe at the end of 10 days, 12 days, you immediately start these drugs. And these drugs do help these patients. Very important is the counseling of the patient. This, you're going to be fine. Avoid patients with cough and cold, avoid dusty area, and hydrate yourself very well. Udik pipa jai bharpur.
Doctor, so anybody who is having mild to moderate CT score, what is his post-COVID situation?
Mild usually doesn't cause much of a problem, but it is the moderate and the severe lung disease that causes a problem.
Okay.
Mild, usually most of the patients just settle on their own. Tinga kai garaj na, bas just rest is required and gradual exercise has to be increased at daily level. Is the moderate and severe lung disease which requires long-term treatment.
Yeah.
Non-COVID, as a post-COVID complications has to be kept in mind for these patients.
Doctor, final question before I let you go. What is your assessment? We are in the middle of a second wave now. Do you think this tapering down in maybe another 2 or 3 weeks, or it is too early to tell?
So right now we are in a tsunami. So we have to wait for the tsunami to settle down. Luckily, we are in a lockdown. Maybe with this lockdown, the chain of spread of the disease will decrease. The load on the healthcare system will come down. Maybe the serious patient reaching the hospitals in an early stage where we can save their life. We need at least another 2 weeks for things to come back to normal, especially the chain of spread. Definitely, if you see the figures, the positive rate has slightly decreased now. The deaths, yes, are high because these are most of the serious patients which have been there earlier also. So maybe next week onwards, we might see a decline in the death. Hopefully with the break in chain of spread of the disease.
Yes, Doctor, last.
But yes, help.
Yeah. The last question की तुम्ही जेन्ना म्हणटात की गेट एडमिटेड ऑन टायम, सद्याक हॉस्पिटलांची परिस्थिती अशी आसा की कोणा जर सांगलें हॉस्पिटलांत एडमीट जा म्हूण तो कोविडा परस चड त्या हॉस्पिटलांतले परिस्थितीक भिता. सो वेन वी टेल पीपल एंड इवन गव्हर्मेंट इज सेईंग कंटिन्युअसली गेट युअर सेल्फ एडमिटेड ऑन टायम. ऑन टायमाची डेफिनेशन कितें?
ऑन टाइम ते खरंच मारतात is very important. He has to report to the hospital. Drop in saturation is very important. The oxygen drop जाता तेजे ते बेगीन hospital येतो.
तुम्ही म्हणतात एकदा ही सिम्पटम्स आयली की 1-2 दीस काडनाकात.
Naka. Immediately, take a hospital was Immediately, no delay. Call the ambulance or on his own. Please go to the hospital. Get himself examined. Start himself on steroids and blood thinner after doing the viral markers and oxygen therapy.
I think very crucial advice. So thanks a lot for joining. These वतात तशे परत उलोवया तुमचे कडेन कारण तुमचे सारक्या एक्सपर्टांचे एडवायजाचेरच म्हाका दिसता गोंयकाराक आता अवलंबून रावचे पडटा आणि these are very important crucial points that because there are so many Goans going through this, these are very crucial points to understand not only pre-COVID, COVID, including post-COVID. So thanks a lot for joining.
Thank you, Pramod sahib. Bye bye. Take care.
Bye.